We are live now, Doctor.
Okay. So, good evening, friends, and good evening, postgraduates, and all the participants for the quiz today. So, this is Pan India Intercollegiate Quiz for the postgraduates. This is being done by Brain Teasers team in association with Ophthalmological Society of Nagpur, and it is the Big Q. So, this is
आठ समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं
तू अपने दम
everyone
पर
wants to
फूक
win.
मार के धूल झाड़
Let's
ले
fight for
छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So, friends, good evening once more, and all the postgraduates, and my pranam to all the mentors. Brain Teaser welcomes you to this fourth quarter final of this fourth season of Big Q. As you are all aware, Brain Teaser is an online platform for hosting quizzes for ophthalmologists from our country since last 6 years, and it was 3 years back when we thought we should have an exclusively dedicated program for our postgraduates so that we can get all the postgraduates on a single platform for them to help them out in understanding the subject and also helping them out with the quiz. Remember, there are approximately 320 plus institutions which are offering postgraduates, call it a MS or a DNB. And we are very happy that we are getting indeed a phenomenal participation in this particular season. We had 350 plus teams who started with the preliminary rounds. And for the quarterfinals, we had amongst them 80 teams. For each quarterfinal, we had 20 teams. And today is the fourth and the last quarterfinal of this particular season. After this, we'll be having two semifinals. For each semifinals, we'll be having 20 best teams, 20 teams each. So that means 40. So the probability of making it into semifinals is almost 50% for you postgraduates, remember. So work hard. And once we are through with this today's round, we'll be letting you shortly about who are the teams who are going to be playing the semifinals. The semifinals will be for two semifinals. Huh. So 10 each, 10 each. So the first semi-final will be on 28th of May. Okay. So
You are wrong.
8 minute. The fourth.
First semi-final will be on the 4th of June.
Okay, sorry, it is on 4th of June. So without much ado, let me thank all the quiz masters who have toiled hard to create a wonderful experience of learning with fun for you. Today's episode, the quiz master is going are Dr. Anurag Mishra, who is currently a director at Radharaman Hospital, Cuttack. Dr. Madhuri Venigala, who is a consultant cornea and refractive surgeon at Sankaraya Hospital, Guntur. And Dr. Sharmila Devi, who is associate professor at Department of Ophthalmology, Thanjavur Medical College, Thanjavur. Remember, such a mega project is never possible without a strong financial backing from the pharma industry. We are extremely thankful to His Highness team, Mr. Suryanarayanan, Mr. Naresh Rautela, Mr. Kautuk for their support and helping us go ahead with this particular season. I would fail in my duties if I don't acknowledge the role of all the His Highness team and the workforce from the field who have made and have gone to each and every postgraduates to get them enrolled. My sincere most thanks to them. And of course, such a flawless execution of Brain Teaser platform is not possible without the Numerotech team who have been with us since since the beginning or the inception of this particular Brain Teaser platform. So now, without much ado, can I request my co-host, Dr. Shilpi Narnavre, to familiarize you with the today's rules of the game. Over to you, Shilpi.
साला कुछ जीतना ही नहीं
Thank you. So, good evening, friends. Welcome back. Today is the last quarterfinal of this season. So, all the best to everyone. Quickly, let's see what is the format. So, in quarterfinals, total 80 teams had played, 20 teams per quarterfinal. And today is the fourth, that is the last quarterfinal. The first semi-final will be played on 4th of June at same time. So the 4 teams, you have to log in through Kahoot platform and the Zoom platform. Each team needs to log in from 2 devices, but single email ID. The first screen is the live quizzing on the Zoom platform. In this, you will be playing with the quiz masters face to face, and this is only for the teams. While the second screen is the Kahoot, which is used for answering the MCQ round, and it is both for the audience and the teams. I request all the mentors to log in from the separate screen only on the Zoom platform. So out of the 20 teams who are playing today's quarterfinal, 5 teams will qualify for the semifinals, and the marks of your today's quarterfinal and the past best 4 preliminary rounds total will be calculated for, this is the criteria for qualifying for the semifinals. Now, let's see, there are 3 sets of MCQs. Each set will have 5 questions. Remember, these MCQs is to be played both by the teams and the audience. There is no negative marking in this subset. While the rapid fire round is only for the teams, 5 questions you will have to answer in the 30 seconds time. For every correct answer, you will get plus 10. While for every incorrect answer, there is minus 5. And if you don't know the answer, just say pass and no marks will be allotted or deducted from your account. So in this round, all the 5 questions will be displayed at a time. You will get 30 seconds. If you know, suppose the second answer, then tell this, the second answer is this. And if the time permits, you can go back to the other question and answer the previous question. Teams who are not playing today's quarterfinal, they can play as an audience, as an individual private practitioner category. So these are the prizes for postgraduates in the finals, while the audience prizes are per episode. So with this, we start with our quiz, and I introduce our first quiz master, that is Dr. Anurag Mishra sir. He has done his 2 long-term fellowships in IOL and pediatric ophthalmology and strabismus from AH Madurai. He has more than 18 years of experience. He has done more than 76 life surgeries, and the count is on. He has more than 12 publications in the peer-reviewed journals. He is a faculty invite for many of the national and international conferences. He is very passionate about understanding and practicing technology. He is director of Radha Raman Hospital, Cuttack, and partner Kar Vision Hospital at Bhubaneswar. So with this, I hand over the screen to Dr. Anurag sir.
Thank you so much, Shilpi. Thank you, Prashant sir, for this grand opportunity. Good evening, all you young guns of AIOS, the hope and the future of the society. I offer you my greetings and regards from the land of Lord Jagannath, and from the team of Big Q, I welcome you all to be participating in this gala event. As you just heard, the quiz would be of 3 rounds. One is the MCQ and then 2 rapid fire rounds following this. So let's get on with the first MCQ round, set 1, question number 1. Remember, before I read out the question to you, this is something that you're going to play on Kahoot, and both the audience and the participants can play these questions. Here's question number 1. According to UGOGO guidelines, all of the following are recommendations for starting immunomodulatory therapy in thyroid eye disease, except, and here are your choices. A, lid retraction more than or equal to 2 millimeters. B, exophthalmos more than or equal to 3 millimeters. C, moderate to severe soft tissue swelling. Or D, corneal breakdown. Your time starts now. Time's up. Let's
Doctor, do not reveal the answer. Just a minute.
Yeah.
Okay, sure.
So the European Graves Ophthalmopathy Study Group had published some guidelines as to start the pulse steroid therapy of 4.5
You can
grams
show.
IV, and to be added on later, pulse steroids if possible, if required, and would be the immunomodulators acting as adjuvants for all these parameters that are there in A, B, C. However, if the corneal exposure is too much and it's potentially likely to lead to corneal breakdown, the only choice that is left with is surgical treatment. The first treatment would be orbital decompression, followed by squint surgery if needed, and finally, lid procedure is to be performed according to UGOGO guidelines. So the correct answer is option D. Let's go to question number 2 now. Identify the incorrect match related to Fuchs. A, Fuchs spots in myopia. B, Fuchs flex in keratoconus. C, Fuchs dystrophy endothelial. Option D, Fuchs uveitis stellate capes. Your time starts now. The incorrect match. Time's up. Let's look at the right answer now. The right answer is choice B, Fuchs flecks, which are small, grayish, whitish flecks, stem-like basal cell aggregates that are seen at the advancing edge of a pterygium, and they're not seen in keratoconus. I hope most of you have got that right. Let's go on to the next question, question number 3 in this round. Which of these following charts is considered the gold standard for visual acuity assessment in clinical trials? Is it option A, Snellen's chart? Option B, Jagger's chart? Is it option C, the ETDRS chart? Or is it option D, tumbling E chart? The time starts now. Well, all of these are used for vision screening and assessment, but the ETDRS chart is used for clinical trials because it's a logarithmic chart. We know that there are certain specifications with this chart, like all the lines have the same number of letters. Their spacing is quite universal and is expressed in a logmar chart instead of a fraction of vision. So ETDRS is the chart. That was easy. I hope all of you, almost all of you, would have got that right. Moving on to the next question, question number 4 in this round. All of the following are side effects of beta blockers, except, here are your choices. A, bronchospasm. B, peripheral vasoconstriction. C, irreversible alopecia. Choice D, altered sleep. The clock starts ticking now. Beta blockers are associated with alopecia, although the alopecia is an example of telogen effluvium, which is actually an expression of hair follicles being sent into a resting phase. So the hair follicles do go for a rest for a period till the beta blockers are withdrawn. Once they're withdrawn, they become active again. So the alopecia that is a resultant of beta blocker therapy is not irreversible. So that's the right answer. Choice C, irreversible alopecia. We go on to the next question in this round. Question number 5. Amongst the following, diode laser cycloablation is indicated in. Here are your 4 choices. Choice A, raised IOP plus counting finger vision. Choice B, uncontrolled malignant glaucoma with raised IOP. Choice C, raised IOP plus asymptomatic blind eye. Or is it choice D, uncontrolled NVG with normal IOP? Time starts now. We all know that cycloablation is a destructive procedure of the ciliary body. So it has to be done in a case which is uncontrolled with traditional or conventional treatment. A raised IOP in itself is not indication enough. It has to be uncontrolled. It has to be malignant in nature. And the vision has to be really, really poor in that eye. I think that concludes this round with the 5th question. Is it not? Yeah. So enjoyed quizzing with you guys. Let me see you on the other side of after the following 2 rounds. Thank you.
So you have to introduce Dr. Madhu.
It's my honor to introduce Dr. Madhuri Venigala, the co-quiz master with me this evening. She's done her MBBS and MS Ophthalmology from Guntur Medical College, Andhra Pradesh, DNB in 2007. She's done a short-term glaucoma fellowship from Shankar Nethralaya, Chennai, cornea and anterior segment fellowship from Shankara Eye Hospital, Guntur. She's got many achievements, like she was a gold medalist in MS Ophthalmologist, Best Outgoing Student Award from Dr. NTR University of Health Sciences for the year 2007. That's very, very enviable, ma'am. Awarded the best paper in APOS 2017. She's working as a consultant cornea refractive surgery at Shankara Eye Hospital, Guntur. A DNB thesis guide and co-guide, mentor, teaching faculty, participates in various journal publications. You can understand the reason why Prashant sir has included her in the panel of quiz masters here. She's obviously presented various papers, and those academic accolades are just parts to her personality. Over to you, ma'am, for the next round.
Thank you, sir, for the nice introduction. I thank AOS and Dr. Prashant sir and Shilpi madam for this opportunity. Let's all the postgraduates and all our colleagues use this in our daily practice. Shall we start?
Yes, ma'am.
Yes, this is a rapid fire round. I think already Dr. Shilpi madam has given us the guidelines. So let's continue.
So team 1 is Team Henley's Lair. Please unmute and keep your video on while playing the rapid fire round. I request all the teams, the respective team. Team 1, Henley's Lair.
I think they're
Yeah. Team 1. Okay. Team 2, Netra. Yes. Please introduce yourself.
Good evening. My name is Nisi. My name is Dr. Anjali. We are from Aravind Eye Hospital, Coimbatore. Currently doing second year residency. Second year residency.
Yeah, okay, all the best.
So are you ready? Be closer to the mic. Okay? Yeah. So yeah, your time starts now.
Orbit it.
Yeah, at least one question, at least fast. Yo. Any guess?
You want to answer any?
So orbited first one.
Okay.
It's the best institution for all.
So time is up. Ma'am, let's reveal the answer and then we can discuss.
Yeah. So in hyperglycemia, there are three pathways. One of that is a sorbitol pathway, where the aldose reductase enzyme is the main one. It converts the excess glucose levels to sorbitol. And what does the sorbitol do? It is unable to, it is an alcohol. It's unable to escape from the lens matter, so it is readily metabolized and it accumulates in the lens, thus altering the cytoplasm, making it hypertonic. So what happens? All the sodium, potassium enzymes and all that water gets accumulated. As a result, the lens loses its opacification and becomes cataractous. So that is that. The next one in Graves' disease, because of the soft tissue swelling, which is the best investigation which we can early diagnosis, is the MRI. The third one is which anti-glaucoma medication is contraindicated in sickle cell anemia. That is, in sickle cell anemia, the ascorbic acid levels get increased. So they increase the sickling in the aqueous humor. So carbonic anhydrase inhibitors, they indirectly increase the ascorbic acid levels. So they are contraindicated. The next is the timing of surgery in case of essential infantile esotropia. It should be ideally before 1.5 years, that is between 6 to 18 months. So as to prevent amblyopia and to give good visual potential. And as early described by Anurag sir, the optotype of every optotype which is used in ETDRS chart is around 0.02 logmar value.
So you get plus 10 for the first answer.
Yes.
So now team 2. I think team 3 have not joined team Hallows. So we move on to the next team, that is team green. Team 4, team green. Dr. Aidur Rahman.
Hello, ma'am.
Yes. Please switch on your video.
Okay.
Yes. So be closer to the mic and introduce yourself.
Hello, ma'am. Myself, Dr. Waidur Rahman from AMCS, Dibrugarh, Assam.
Myself, Tanjima Ahmed from Dibrugarh, Assam, Assam Medical College and Hospital.
Okay. So are you ready?
Yes, ma'am.
All the best.
All the
So
best.
your time
Mhm.
starts now.
Smoke. Ma'am, A is snowflake category. Number 2 is dog.
Fogging.
Okay.
Also planning on the count.
Okay. Time is up. You want to attempt any, but will not get the marks. Okay.
Okay.
The cataract associated with chalcosis, that is a standard question, which is a sunflower cataract. The second is, as you have already mentioned, is the Toxoplasma gondii. It is a definitive host is a cat and intermediate is a man, where that life cycle appears and the lesions develop in the man. And the third one is for the fine details, what are the suggested cuts for CT scan, whether it is axial or coronal cuts, it comes at 1 millimeter interval. So that we can have all, if it is a orbit, if any lesion, any mass lesion or any discontinuity in the bone or any inflammatory swelling or any impinging lesion on the optic nerve, anything can be seen, very small interval cuts. And the next is frequency of rebleed after a traumatic hyphema. It is around 4 to 35%, and usually it occurs within 24 to 48 hours, where we have to intervene surgically. Otherwise, until that, we can observe until IOP is not so much, or until corneal endothelial staining is not done, we can go for medical management. If it is not so, if it is if it is more rebleed and more IOP raise and more pain, then we have to intervene. And the last is a beaten bronze. A classical appearance is seen in iridocorneal endothelial syndrome.
Ma'am, what about the second answer? I mean, I couldn't hear that.
It's a definitive host for Toxoplasma gondii, like
No,
Toxoplasma.
But they answered, I mean, what you answered? Team 4?
Team 4 answered cat, I think. No?
Dog. Dog, they answered.
They have
And
answered?
dog.
No, only only one question they
One
have
is
answered.
correct. Yeah, so it is plus 10 for the
Yes.
first and minus 5 for the second. So it's plus
Second.
5.
Okay.
So next team, team 3, team 5, phakic IOLs.
Hello.
Hello. Please
Good
introduce.
evening, ma'am. Good evening, ma'am. Myself, Dr. Ishan Goel. We are finally residents from Belgaum Institute of Medical Sciences.
I am Dr. Shikhara. I am also from WIMS Belgaum.
Okay. Welcome. All the best.
Thank you so much.
Thank you. Thank you.
So are you ready?
Yes, ma'am.
So here I have a set of questions and your time starts now.
Which is different from anatomical features. which antibiotic configuration. Configuration of rays, that is Trump's conoid, which should be the corneal grafting correlation same side. Iron
Okay.
deposit ring around the keratoconus is that anatomical feature. It arises from the interior aspect of the inferior ridge of the inferior border of the orbital rim, and what an antibiotic MRSA, and iron deposit ring here, that iron deposit ring, Kaiser fish, Kaiser ring, Kaiser's something.
Okay. So, yeah, the answers.
Yeah.
Fisher.
We can give two questions, ma'am, within the time.
Three questions we can give. MRSA, Sturm's conoid, and
Yeah,
Fisher.
So, yeah, okay.
But
The
first one is wrong. So
first
it's
is wrong.
25.
Yeah.
Okay.
So the first, the anatomical feature of the inferior oblique muscle, which differs from the others, is that is on the medial side of the orbit, and it's innervated by the trochlear nerve. And the antibiotic resistant strain is MRSA, and the third is a Sturm's conoid. And the fourth is, why should the corneal graft in the keratoconus be the same sized, because so as to compensate for the postoperative myopia in these cases. And the last, the ring deposit of iron around the cone is the Fleischer's ring in case of keratoconus. It can be, it cannot be, need not be in every case, but if it is a very diagnostic sign.
Thank you.
Thank you.
So next team, team 6, Genic boys. Genic boys. Yes.
Hello, ma'am. I am Dr. Vinayak, and this is Dr. Gun. We are third year postgraduates from Guru Nanak Eye Center, New Delhi.
Okay, all the best.
Thank you.
So,
1, 2, 3.
your questions and your time starts.
Four is nitrous oxide, ma'am.
What?
First is outer plexicum layer.
Yeah, okay.
Neisseria species was ophthalmic neonatorum. What is anisopony? It is the
defensive side of the object. In the pupillary margin is Scopis nodules.
Okay.
And what the fourth one?
Third question.
Third question you told, ma'am.
We told
difference in size.
Size.
Fourth.
Fourth is
Nitrous oxide.
nitrous oxide, they told, ma'am.
Okay. So, ma'am, they answered all.
All, yes.
Yes.
Second
Though we
question
have
they
not
answered.
included, yes,
Yeah.
the Nigoria, this, but we can consider
We
that.
can consider. Acha, okay.
So congratulations, all 5 are correct.
Yeah, relatively maybe easy.
So, ma'am, you want to explain anything in this?
They're self-explanatory, ma'am. It's okay. Only the which that GA nitrous oxide is the thing, which it if the child needs intraocular bubble, it has to be avoided because it causes the expansion. Otherwise, it's okay.
So next team is team 7, Vision. Have you joined team 7? Vision team 7. Okay. We move on to the next team, that is team 8, Vibgyor.
Hello, ma'am.
Hello.
Hello. Only one member in the team?
Yes, ma'am.
Okay, all the
Where
best.
is your other partner?
Ma'am, she is not available today. She had some family.
No issues.
Which place are you from? Introduce yourself.
My name is Kajal Pal, and I have done my MS in ophthalmology from Banaras Hindu University.
So you are now, what are you doing now?
Ma'am, I am a passed out and I am doing SARship from a private college.
Okay.
Okay.
When you have joined this SRship?
Ma'am, 1 month ago.
Okay. Okay. So, are you ready?
Yes, ma'am.
Okay.
Second is trauma to the optic nerve.
Portion.
Which portion?
Which portion of the nerve? Okay, next.
What is coupling ratio, fourth question?
Okay.
Um, and differential tonometry.
Okay. So time is up. Let's see what are the answers.
So what percentage of patients with necrotizing scleritis have a detectable systemic disorder? It will be around, 50%. Some can have autoimmune diseases like venous granulomatosis or rheumatoid arthritis, like etc. The list is huge, but mostly we won't get a detectable systemic disorder in around 50% of the cases. And the most common site of injury to traumatic optic neuropathy is the intracanalicular portion of the optic nerve. It has the intraorbital part, intracanalicular part, intracranial part. So we have to be specific. And the Frisby test requires which type of glasses for stereo? There are no special glasses required, and natural vision is used. And the refractive surgery, the relationship between changes in the curvature of the cornea in one meridian and the induced changes in the orthogonal meridian is known as the coupling effect. And the last is the tonometry, differential tonometry in different gases in thyroid is a sign which says is around the Braley's sign. So we can take for one answer, ma'am.
Yes, plus 10.
Plus 10, yeah? Okay.
Yes. So with this, we end with the first round of this rapid fire round with you, ma'am. So please introduce Dr. Sharmila, ma'am.
Welcome, Dr. Sharmila, ma'am. She is an associate professor in the Department of Ophthalmology of Tanjavur Medical College. She has been working since January 2024. She has been a cornea and glaucoma consultant since 2009 till December 2023 in RIO. She is a joint secretary of Tamil Nadu Ophthalmic Association, an immediate past editor of TNOA Journal. She's a member of Cornea Society, Glaucoma Society of India, and AIOS. She has active participation in various PG teaching programs in RIO and across the state of Tamil Nadu and AIOS for the past 15 years. And she's a winner of the All India quiz conducted in AIOS Kolkata in 2016, has won cash awards in 18 and 2023. So she must be the inspiration for all of us to be the quiz master now. And she has been the editor of the TNOA Journal, and she has undergone short-term surgical training for SLET and Tinon's Patchcraft in LVP Hyderabad, and she's a phaco trainer and keratoplasty trainer for many ophthalmologists across the state. She has special interest in ocular surface and has participated in many surface workshops conducted by SN Chennai and LVP Hyderabad. She has conducted research methodology workshops along with IJO editor Dr. Santosh Honavar. Welcome, madam, and over to you, Dr. Sharmila, ma'am.
Thank you so much, ma'am, for the kind introduction. Good evening, everyone. At the outset, I would like to thank Prashant sir and Dr. Shilpi for this amazing organization. 350 teams is huge, and I think this big queue is widely popular among the postgraduates. So really looking forward to the participation. Can we have the questions?
Yes, ma'am.
And teams, are you ready to shoot your answers?
Yes. So the next team is Team 1. Have you joined? Team Henley? Yes. Please switch on your video also. Team 1. Okay. Sai, can you help them? Meanwhile,
I think there's an issue with the video, but can they speak? Team 1, can you speak? I think we will go ahead with the next team, madam. We will just.
Okay, yeah. Meanwhile, you please help them out for the same.
Yeah.
So the next team is Team 9, Oculus Curatio.
Yeah, the fancy name.
Yes.
Hello.
Hi.
Ma'am, actually we are at distant places. Can we join on two screens?
Yes, I have already informed you.
Okay, okay.
So where is your other partner?
I'll just ask her 1 minute.
Can we move ahead with the next team by then?
Where are you from? Okay.
We are from M.M. Joshi Eye Hospital, Hubli, ma'am.
Okay.
She's there, ma'am.
Yeah. So, okay.
Good evening, ma'am.
Good evening. Please introduce yourself and be closer to the mic.
Am I audible, ma'am?
Yes. Good evening.
Good evening, ma'am. I'm Dr. Uttara Bhatt. I'm second year primary DNB from M.M. Joshi Eye Institute, Hubli.
Wonderful.
Ma'am, I'm Dr. Saurabh from the same institute, ma'am.
Wonderful. So you ready?
Yes, ma'am.
Yes, ma'am.
So this will be a combination of basic sciences and some academic. Yes, your questions.
First is gas.
Very good. Plus then.
Okay.
The acronym RBP.
Panams area is the area in the visual field in which, at focusing at one point, we don't have diplopia.
Very good. Plus then. Next question.
The hyperreal study. Example of.
See the picture. What is the finding? The finding and see. Do you want to take any of these questions? What is it?
No issues. So,
Okay.
time is up.
Plus 20. We got two answers right. Yes, the staging of macular hole, you got it right. RPPDAT, Oftal is a lot of acronyms, so I think you should be knowing at least a few essential ones. So that's the newest one. That's the Rose Bengal photodynamic antimicrobial therapy for patients with progressive infectious keratitis. You got Panams area right. That's the area of binocular vision without diplopia. The drug which is used in herpetic eye disease study for epithelial keratitis is trifluridine. And the FFA finding is an example of hyperfluorescence where you can see the pooling of dye and CSCR. So it'll be a combination of history, basic sciences, and some diagrammatic representations. So they get plus 20. Very good, M.M. Joshi.
Thank you.
Thank you.
So the next team, team 1, is your issue resolved?
Yeah, they are there, madam. No.
Yes. So please introduce yourself, team 1. We can't hear you.
I can't see you either.
Yeah.
I think the video is resolved, but audio is not resolved. We are not able to hear you.
Okay. Meanwhile, you resolve it. We move to the another team. Team 10.
Kai sir is the biggest quizmaster here. He is cutting down on a lot of teams.
Team 10. Yes.
Hello, ma'am. I'm Vaishnavi. I'm Urja, and we are from Kasturba Medical College, Mangalore. We are final year residents.
Welcome. So you're ready? Can we go for the question?
Yes, ma'am.
And be closer to the mic, okay? Yeah. So your time starts now.
Yeah. Ma'am, second is gonioscopy assisted transluminal trabeculotomy. Color study seen in uveal melanoma. Ma'am, air can be used, SF6 and C3F8 can be used. Concept.
So the first one, the size of the patient versus smile. Take a guess.
Acha, you attempt now, will not cut the marks also.
It's good for them to get all the 5 right. I got 4 right, which is very good. Plus 10, plus 40.
40.
Yeah. So the size of the incision used to smile is 2 to 3 millimeters. You got GAT right. The minimal invasive glaucoma surgeries, I think all of you should know what are the mixed procedures. The colisted appearance is seen in choroidal melanoma, and you got the agents for desmetopexy correct. It's air, 20% SF6 and C3F8, and that is the sunset glow fundus in VKH. You got plus 40.
Yeah. Thank you, ma'am. Very good. So the next team is team 11, iris illumination.
Illuminati.
From the same college.
Hello, ma'am.
So your mentor is here?
No, ma'am.
Okay.
Ma'am, I'm Dr. Amu, and this is Dr. Nishvesh from KMC Manipur.
Hello.
To the mic, we can't hear you.
There's a lot of echo.
Ma'am, I'm Dr. Anmol, and this is Dr. Nishwash from KMC Manipal.
Please be closer to the mic.
Yes,
We will not be able to hear your answers then.
Yes, yes, yes.
You're from KMC Manipal, that's all we know.
Yeah. So the last team was also from the same college.
Ah.
So are you ready?
Yes, ma'am. Yes, ma'am.
Okay. So your time starts now.
That's first one. Whatever you know, you can answer.
Ma'am, fifth one CS. Fifth one is CS.
One is?
Yes, sir.
No. You have some lesions there. The anterior segment in vitreous is quite. You want to take anything else? Percent?
Inmate is there.
The time is up.
We go to the answers. Erysophage is an instrument. Yeah, there's a bit of history in every question, every set of questions. So the erysophage is used in intracapsular carrot extraction. I'm sure none of you would have seen it, so that's why I wanted to include it in history. DUSN is diffuse unilateral subacute neuroretinitis due to the lava. Cartwheel appearance seen in X-linked juvenile retinoschisis. You get conjunctival black deposits in when your the patient is on therapy with epinephrine, and that one is a presumed ocular histoplasmosis syndrome, POHS. So they do not say anything. It's okay next time.
Ma'am, they answered the last answer wrong, so it is -5 to them. So the next team is team 1. All the issues resolved or not?
No, they have an audio issue, madam.
Oh, then what to do?
Team 1, I suggest you close your Zoom and log in back.
Okay, we'll take you later. So the next team is team 12. Team 12,
They have not joined, madam.
they joined. I saw them. They are not there now. Okay, team 13.
Hello.
Hello.
Hello, am I audible?
Yeah, good evening, doctor.
My teammate will be joining from another device as couldn't be here with me.
Okay.
You're from? Your name and
We're both, the team name is Ayul Masood. We're from Ramaya Medical College. Okay. My teammate has joined. Am I audible, ma'am?
Yes, yes.
Yeah.
Please introduce yourself.
I am Dr. and he is Dr. Akshay. We are both GRP.
Okay. So are you ready?
Yes, ma'am. Yes, ma'am.
Your
Please
questions.
use the mic. Yeah.
Please be ready to shoot the answers.
Your time starts now.
You're ready, please. Discover radial keratotomy. Are they there? Do they want to take any of it?
Yeah, we're here, ma'am.
Yeah. Do you want to take any of it?
No.
Time is up. Okay.
Okay.
Let's see the answers one.
The implantable miniature telescopic lenses are used in ARMD. Who discovered radial keratotomy? He was a Russian ophthalmologist. He's also a politician, Safedrov. He was the pioneer in refractive surgery, and he also discovered the phakic lenses as well. DRIL is a very important biomarker. It is disorganization of retinal inner layers in OCT. Swiss cheese appearance is seen in band-shaped keratopathy. According to Linkoff's rule, so this kind of appearance, it's seen, where is the likely break? It is at 9 o'clock. So they didn't get anything right. and they were too cautious not to give any wrong answers as well. 0. Better luck next time.
So next team is team 14, MB square.
Yeah.
So iPhone is team 14.
Yes, ma'am. We have changed our name.
Okay, it's okay. So you are team 14, MB square.
Yes, ma'am.
Okay. Please introduce yourself.
Myself, Maulika from Meenakshi Medical College, ma'am. I am Dr. Manali from Meenakshi Medical College.
Meenakshi Medical College, Kanchipuram.
Yes, ma'am.
Okay.
Be a little louder and be closer to the mic, please. Hana?
Yes, ma'am.
So, are you ready?
Yes, ma'am.
Be louder.
Yes, ma'am.
If you know half of the acronym, it's okay. Ken.
What is Tonopanium?
First one is Tonopanium.
Tonopanium.
Okay. Pioneer something that we do every day. Do you want to try for any other question? At least part of it? DSAEK? Okay. So they didn't get anything right. They actually got one question wrong. The ideal tonometer, I asked about the ideal tonometer. Tonopen is for irregular corneas. Ideal tonometer to measure intraocular pressure in post-LASIK eyes is dynamic contour tonometry. Who pioneered the technique of continuous curvilinear capsular X is something that we do every day. It's Howard Gimbel. So you should definitely go to the Gimbel's library and look at that. And Triple C actually gets its name from 3 people. So one is Gimbel, another one is Thomas Newhan. So you should be looking at that as well. UTDS AEK is at least the second half you should be knowing. Descemet stripping, automated endothelial keratoplasty. UT is ultra thin. In pattern ERG, the signal is generated in retinal ganglion cells. And that instrument is a modified Wurst pigtail lacrimal probe used for canalicular repairs and lacrimal procedures for canalicular injuries. So they actually get 1 -5 for the first question. Better luck.
With this, we end with the second round of rapid fire. And now it's again time for the MCQ set by Dr. Anurag sir. So just refresh your Kahoot screens.
Thank you, Shilpi. Here I'm back with the second set of MCQ questions in this quarterfinal of Big Q. I think all teams, participants, and audience are ready, and their fingers are at the ready with the mobile phones to play on Kahoot. Let's get on with this round. Here comes question number 1 in this round. All are ISGBD, International Study Group of Behçet's Disease criteria, except choice A, recurrent oral ulceration, choice B, erythema nodosum, choice C, positive pathology test, or choice D, HLA-B51 positivity. The time starts now. So recurrent oral ulceration stands at this central area, along with 2 of the other lesions have to be there, like the genital ulcerations, the eye lesions, skin ulceration, and positive pathology test, which is a response to minor injuries. HLA-B51 has a strong association with with Behçet's disease, though, in certain populations, but it is not one of the criteria described in this particular ISGBD study group. So that stands as the right answer, choice D, HLA-B51 positivity. Let's go on to question number 2. All are true regarding mutes, except is it choice A, foveal wreath-like granularity, choice B, enlarged blind spot, choice C, FFA, early hyperfluorescence with late staining, Or is it choice D, more hyperfluorescent spots on ICG angiography? Your time starts now. Right. Multiple evanescent white dot syndrome, as we know it, is associated with all the three other features. In ICG, on ICG, it shows hypofluorescent spots though. On FFA, it shows early hyperfluorescence, autohyperfluorescence, which actually becomes isofluorescent on exposure to blue light. So choice C in here is the right answer. The next question coming up on your screen, identify the incorrect conclusion out of these study group results in connection with BRVO. SCORE BRVO study proposes intravitreal triamcinolone injections to be as effective as macular grid laser treatment. Choice B, Geneva study predicts 0.7 milligrams of DEXA intravitreal acts better than sham controls. Choice C, CRAVE study predicts bevacizumab is less efficacious than ranibizumab in reducing macular edema. Or is it choice D, which is the right answer? The BVOS suggests that macular laser treatment as the standard of care for BRVO. Your time starts now. The correct answer is choice C, the CRAVE study, which studied 98 individuals with the same condition and tried both the drugs, actually came out with a conclusion that both of these drugs are equally efficacious in reducing macular edema in BRVO. The other propositions from the other studies are correct in relation to BRVO. Next question on your screen, ladies and gentlemen. All of these following choices are seen in non-proliferative sickle cell retinopathy, except find out the wrong choice. Choice A, silver wiring of arterioles. Choice B, macular elevation sign. Choice C, angioid streaks. Or is it choice D, salmon patch? Your time starts now. Time's up. Silver wiring of arterioles, angioid streaks, Salmon patch, iridescent spots. These are all features of non-proliferative sickle cell retinopathy. However, when the disease progresses, because of the progressive atrophy in the macular region, the macula actually goes in for a more concavity. So there's no elevation. There's actually a depression in the macula, which results in visual loss as the disease progresses further, because of the hypercoagulopathy of the vascular network that supplies the tissue in that area. Moving on to the next question. Which option is incorrect according to Lee's classification of posterior polar cataracts? We know that there are several classifications of posterior polar cataract, one proposed by our very own Dr. Vasavada, but this is about the Lee's classification of posterior polar cataract. Choice A, grade 1 is seen by PPC plus PSC. Grade 2, onion-like ringed PPC appearance. Choice C, grade 3 is marked by PPC plus thick posterior capsule. Or is it choice D, grade 4 is marked by onion ring PPC plus PSC plus nucleosclerosis? The time starts now. This is more common sense than anything else, actually, to find out the right answer amongst these four choices, because posterior polar cataracts, because there is an infiltration of mesenchymal tissue into the lens cortex, posterior parts are involved more, and it is never ever associated with a thickening of the posterior capsule. Whatever happens to the posterior capsule is always on the thinner side. So the posterior capsule is either normal or is thin. It is never thick, overlying the plaque of PPC on the posterior pole. So that's the right answer, grade C. This was easy, but common sense. The next question on your screen.
So that we are over with the next
You
set.
over? Okay, all right. Okay.
Next, last set is remaining. So
Okay.
After the teams, yeah. So teams, now it's time for a short break. So thank you, His Highness team, for all the support. And this is a small promo video from their team.
मैं अपना डब्बा लाना बोला है मैं जल्दी
So teams, are you ready for the rapid fire round? Madhuri ma'am?
Yes, yes. Introduce yourself. Already done before.
Team one.
Team
Can
one,
you-
yeah.
Ma'am. Yes, ma'am.
Yes, now we can hear you.
Okay. Ma'am, myself, Dr. Harika Kasreddy. I am Harika Gajila from AIMS Raipur, ma'am. Final year. Final year post.
So are you ready?
Yes, ma'am.
Okay. So all the best. Your time starts now.
Cholesterol. One cholesterol, ma'am. Second safe strategy. It will not move, ma'am. Third.
Okay.
Last two questions you want to answer? Okay. So let's see the answers.
So deposits in Schneider's dystrophy of cholesterol. That's correct. The second one, prevention strategy used in trachoma is safe strategy. The third one, which you have pointed, said wrong, because as a neutralization point is reached in retinoscopy, the speed of the reflex increases. And the fourth one is the modified Friedman or modified Dandy's diagnostic criteria are used in idiopathic intracranial hypertension. And in fifth, in chorioretinal coloboma, the thinned out layers of the retina are called the intercalary membrane. So you get two, ma'am, two right answers.
Plus 15. Two right, one wrong. So
One wrong. Yeah.
So plus 15. Yeah. So the next team is team 15, JBS Sims.
Yes, ma'am.
You are not, I mean, please, yes. So you are playing alone?
My teammate is joining from some other device.
Okay.
Okay.
So meanwhile,
You introduce yourself.
I'm Dr. Julia Kosa, second year PG resident from Shadan Institute of Medical Sciences, Hyderabad.
And your teammate?
Is joining us.
Okay. So you want to play? We go ahead or we wait for her?
Yeah, we can go ahead.
Okay. So all the best.
Yeah. Fourth one is
Right. Third one you can try.
Fifth one is diabetes with pupillary involvement. So
No.
pupillary मतलब वो aneurysms वगैरह कुछ.
How many?
Passed. Only fifth one.
Okay.
So the immune mechanism in the VKH syndrome is the T cell mediated. In thyroid eye disease, the most common muscles affected are the first is the inferior rectus, followed by the superior rectus. The reduced Snellen's tests are used to test the near visual acuity. And suture material which used in GAT is the blunted 5-O-proline suture. And most common cause of isolated nerve palsy with pupillary involvement is intracranial aneurysm. Without pupillary involvement is a diabetes. So, ma'am, how many will get?
Ma'am, what you want to, I mean, last question, whether you want to give them or what? Because initially he said.
Yeah. Okay, ma'am, we'll give. Yeah. No other question she answered. No, only that she first.
Okay, so plus 10.
Plus.
Okay.
Okay.
Thank you.
So the next team is team 16. Please introduce yourself.
Good evening. I'm Dr. Vidanti from PMCH Patna. Am I audible?
Yes, yes.
Good evening, ma'am. Myself, Dr. Neetu Sinha, JR2 from PMCH Patna.
Okay. So are you ready?
Yes, ma'am.
So your time starts now.
Answer for first is 0.
Okay.
Answer for fifth question is 2 to 3 mmHg. Answer for second MRI.
So the first one is correct. Snellen's 2020 is equivalent to log max 0 value. So you get an answer for that, mark for that. The second is investigation of choices in keratoconus fistula is digital subtraction and geography. Third is in the sixth nerve palsy, the face turn of the patient will be towards the lesion. Suppose if it is left sixth nerve where the abduction deficit is there, the patient's head face turn will be towards the left side. And the fourth is the measurement of tear mucin content is assessed by measuring the levels of these enzymes in the tear film like ME5AC and hexosamine. And the normal dilation is around 3 to 6 millimeters of mercury. So they
And
get.
the answer 2 to 3.
So what, ma'am? We'll.
Okay, we give. So first is correct, fifth is correct, second is wrong. So it comes out to be plus 15.
Okay.
Okay. So the next team is team 17, Squid Gamers.
Hello.
Hello.
Yes, can you on your video?
No, it is on.
Okay.
Okay.
Be closer to the mic and speak.
Hello. Yeah, I'm. Can you hear me, ma'am?
Yes, yes, we can hear you.
Okay, okay. I'm not sure why my video is not working. I've switched it on.
Okay, not an issue.
Okay.
Please introduce yourself.
I'm Dr. Lubna from Saptagi Institute of Medical Sciences, Bangalore. My partner could not join today.
Okay.
Yeah.
So, okay. So are you ready for the questions?
Yes, ma'am.
Okay. So your time starts now.
Yes, anyone? First question, try. Can have a guess.
Okay.
Okay.
So let's see the answers.
So what is the maximal medical therapy in glaucoma? Use of 3 or more than 3 drugs to achieve maximal IOP reduction. If it is not that, then we go for surgical correction like DRAP. The second one is which eye muscles are unaffected in myasthenia? They are the smooth muscles of the pupil and ciliary muscle. And third, what is the instrument used to perform Bruckner's test? Where in young infants with direct ophthalmoscope, we can see the red reflex from a distance. The fourth is internuclear ophthalmoplegia is caused by the lesion in the MLF, that is in the medial longitudinal fasciculus. And the whitish spot seen at the posterior lens surface, which is caused by the remnant of the hyaloid artery, is the mid-Tandorf start.
So 0 for them. Ma'am, actually, 2 teams didn't join. So I'm cutting one set of yours and one of ma'am.
Okay.
Okay, so
that's done, ma'am, for today.
Yes, ma'am. Ma'am, but we'll need you after this quiz. So please don't go
Okay.
for the discussion part. Just give me 2 minutes. So Sharmila ma'am.
Yeah.
So the next team is team 18. Yes.
Good evening, ma'am.
Good evening.
Evening.
Yeah, I'm Dr. Anand Gandhi from Jawaharlal Nehru Medical College, Varda. My teammate cannot join today, unfortunately.
Okay. So you are which year resident?
I'm a final year resident.
So all the best. Your time starts now.
Yeah. Try English.
Any answer? Okay.
So the research drug used to dissolve the clump lens protein is lansoprazole. How did Louis Bale lose his vision? So one eye to trauma, the other eye to sympathetic ophthalmia. You have his statue there. Expand SDI. SDI is stereoscopic diagonal inverter, which is used in the operating microscopes to invert the image, which is used for retina surgeries, vitrectomy, and ILM peeling surgeries. Mudslung appearance is seen in oculocutaneous albinism carriers, and that is Nessie, that's the mythical character, Loch Ness phenomena. So it's compared to the loop of vessels in gonioscopy in congenital glaucoma. So you have two phenomena in congenital glaucoma. One is Loch Ness, the other one is Lister's morning mist. So you should be knowing both of them. Unfortunately, you haven't scored any, so it's 0. Next team.
Next team is team 19.
Team 19, are you there?
Yes.
Hello.
Hello. Please introduce yourself.
Yes, ma'am. We are Dhruvi and Ankita from Baroda Medical College.
Which year?
We are second year residents.
So.
Are you ready?
Yes, ma'am.
Okay.
50 proline.
Repeat the last year another question.
Yes.
Look at the other.
B-cell lymphoma, 5th one.
What is DWK? Do you want to try DWK? It's used in fugues.
No, ma'am.
Okay. The suture material used in GARD is a repeat. You want to answer what is Zen implant? You know what is Zen implant? That's okay. I think we'll have to give it to them. Zen implant is again a minimally invasive glaucoma surgical procedure. So when I saw that question, I thought I'll change it to this, but unfortunately the PPT is not with me. So the size of the normal optic foramen radiologically is 6 millimeters. DWK is decimetorexis. Without doing an endothelial keratoplasty, it's done for fugues. And where do you get brush peel spots? Those are white or grayish brown spots in the periphery virus seen in Down syndrome. And this, you got it wrong. I think you said something else. It's basal cell carcinoma.
B cell lymphoma, I think.
Yeah. So they get plus 10?
It's 5, plus 5. Plus 10 for the first and minus 5 for the last. So the next team is team 20, eye catchers. Yes. Please introduce yourself.
Eye catches, can't see you.
See, we can't hear you.
Are you there? Can you introduce yourself?
I can see them, but they are not audible.
Oh. Shall we start?
Ma'am, we can't hear them. Sai, can you just check with them?
They'll have to log off and log in again in Zoom.
Please do it quickly. We are left with the one team only. So the next team is Team Theos. The last team.
Unmute.
Yes.
Yeah. Hi, good evening. Can you please introduce yourself?
Ma'am, Dr. Shambhavi from PMCH Patna. Dr. Simran from PMCH Patna.
Okay.
Which year residence?
Second year.
Second. Okay. So you have to be loud like second year. Okay.
Yes, ma'am.
Yeah, time start.
You want to try something? Are you whispering? Is it a 5 guy? The length of the optic nerve you can try.
Kya?
Length.
Of the answers?
Hello, ma'am. Hello.
Yes.
Yes.
Ma'am, third is 50, 50 millimeter. Fourth 50 millimeter. And to get the pie in the sky in the region is adenoma, pituitary adenoma only, I think.
No. Pie in the sky, which lobe? Temporal, parietal.
Pie in the sky, inferior lobe.
Random spider.
Okay. So time is up.
The gonial lens used for MIDS is Van Jacob lens. EG is many people will come to you for a fitness certificate and they'll ask for the EG test. EG is Edrich Green Lantern test for color vision. Where do you get pie in the sky lesion? Superior quadrant anoxia and temporal lobe lesion. It is for temporal lobe. Pie on the floor is parietal. The length of the optic nerve is 40 millimeters. You said 50. It is wrong. -5. Retisert is a fluocinolone acetonide intravitreal implant. You can see it here for uveitis.
It's -10.
-5.
Ma'am, what about the third one?
Yeah. -10.
Okay. So team 20. Have you logged in again? We can't hear you. No.
I'm happy if the answer. So, I'm very lenient when it comes to negative marking.
So,
That team is lost.
no, they are there, ma'am, but we can't hear them. What we can do
Sai,
is, can you just
Right and show otherwise.
कॉल पे बात कर लें उनसे क्वेश्चंस और वो आंसर
Next
कर
later.
लें खत्म हो गई लास्ट टीम
Okay.
Sai, what can we do?
Sai.
They have an audio problem, madam, because if the audio is not getting connected, they won't be able to hear us, but they're hearing us, so it's a system problem.
Can you hear us? Team eye catchers. Just show your thumb up or down if you can, if yes. So, okay, I'll give you a call. You can answer me on the phone, okay?
Dr. Shilpi is going out of the way to be inclusive.
Ma'am, because this is the last team, we cannot accommodate them in the next, Theos
Last
team.
quarter.
They are from the quarterfinal 3 team. The same thing happened with them in the last quarterfinal. So,
Yeah,
but this thing,
easy,
there is
bilateral.
yeah. So I'm calling you team eye catchers. Yes. Okay. So you will answer. Okay.
Your questions. I think if they had listened to Anurag Basu sir, they would have got the 5th question right.
So first one you answered was immunomodulator. Okay. Second one. Okay. Third one. Pass. Fourth one. Okay. And the fifth one. Okay. Great. Ma'am, first one the answer is immunomodulator.
Yeah, okay, we can give it to them. It's actually a calcineurin inhibitor, but yeah, we can give it to them.
So plus
What?
30 to them, ma'am.
Yeah.
They answer first, fourth, and fifth to they pass.
Dispersive viscoelastics,
Yes, they answered. Then pathological myopia, high myopia, they answered. So second and third, they pass the bush.
So plus 30 for them. Very good. So what feels like a bag of worms is the orbital varix, and CARES is an innovation from Chennai. It's from Dr. Susan Jacob. It's corneal allogenic intrastromal rings for keratoconus instead of the synthetic segments.
Yes. So with this, we end with the rapid fire round, and last set of MCQ is remaining.
Anurag.
Yeah, Sharmila, just make your memories. I'll just make your memories afresh. You substituted the Mishra for a Basu. Anurag Basu is actually a film director, and that's not me. I can assure you that. All right.
So you are now less than.
I wish I learned more that way. All right, participants, audience, after that light moment, we would go on to the next round of MCQs. The first question is here on your screen. First documented ICCE was performed by choice A, Bradford Shingleton, the president of ACRS some time back. B, Luther Fry. Choice C, Samuel Sharp. Or is it choice D, Joaquin Baraka? Your time starts now. All of them have been great innovators in the field of cataract surgery. Shingleton, Luther Fry with its phaco sandwich technique, Baraka with multiple innovations. But the first documented ICCE in this 18th century was actually performed by Dr. Samuel Sharp. So that's the right answer, choice C. Let's move on to the next question. Who was the first person to actually perform the circular tear capsulotomy, even though he's not generally credited with it? It's a very, very interesting question. And if you have heard Sharmila's set of rapid fire questions in the previous round, it might just give you a clue, or will it? Let's see. Choice A, Thomas Newhan. Choice B, Howard Gimble. Choice C, Calvin Farshaw. Or is it choice D, Little and Sinsky? Your time starts now. Thomas Newhan is a German. Howard Gimble is a Canadian. Both of them used to do the same technique of continuous stare capsulotomy in the 1980s. All right. Both of them were working together at Munich when this technique evolved. Now, the term continuous curvilinear capsulorhexis is actually the contribution of three different surgeons. The term continuous came from Gimbal. The term curvilinear came from Shimizu, who was a Japanese surgeon who was also doing a similar technique back then. And finally, capsulorhexis was coined by Thomas Neumann. However, before all these three, in the 1970s, the first described continuous stare capsulotomy technique was being practiced by one surgeon from the United States called Calvin Fershaw. Of course, he did not publish his work. He could not do it because of his prolonged ill health. So that's very interesting that this is the guy who actually brought this concept to the world. Next question on your screen. Dua's layer is seen anterior to which corneal layer? Easy. Options are corneal epithelium, A, B, corneal endothelium, C, the Deschmann's membrane, or is it choice D, stroma? The clock starts ticking now. He is a pride of Indian diaspora living abroad, Dr. Harminder Singh Dua, who described another layer in the corneal tissue, which is actually a 10 microns thick layer and chiefly consisting of collagen type 1 and 6, sitting right between the stroma and the Deschmann's membrane. So it sits anterior to Deschmann and posterior to stroma. That's where it sits. Next question on your screen in this round. The cilioretinal artery fills in which phase of fundus fluorescein angiogram out of these four choices? Choice A, is it the late arteriovenous phase? Choice B, choroidal phase? Choice C, recirculation phase? Or is the right answer choice D, early arterial phase? Your time starts now. The cilioretinal artery is actually a branch of the short posterior ciliary arteries of the choroidal vasculature. So it starts filling in the pre-arterial or choroidal phase. It fills again in the arterial phase because it's a part of the retinal vasculature as well. Next question on your screen. Moving on. Which of the following is not included in BET OTS classification, ocular trauma score? And BET, as you all know, stands for Birmingham Eye Trauma Terminology. Which of these following is not included in BET OTS classification? Is it choice A, corneal edema? Choice B, retinal detachment? Choice C, endophthalmitis? Or choice D, visual acuity at presentation? Your slab of 10 seconds start now. PET classifies injuries into two categories broadly: closed globe and open globe injuries. They chiefly describe the manifestations of these injuries, including perforation, both lamellar and penetrating, retinal detachment, endophthalmitis that occurs therein, and visual acuity at presentation. It does not include corneal edema as one of its parameters. So are we done? I think
Yes, sir. Yes, sir. Yes, sir.
All right. Thank you.
So thank you, Anurag. Wonderful. As expected, all the three quiz masters were wonderful. Wonderful questions. We really enjoyed, as well as it was a learning experience for all of us. So Sai, are we ready with the private practitioner category? Because postgraduates, remember, we will be computing the results of all the 4 preliminary rounds, and we will be letting you know in shortly the semi-finalist in another 2 days. So meanwhile, we can have a small chat with the private practitioner categories who were into the top 3. Welcome, Suryanarayan sir. He's the director.
Sir, good evening. Good evening.
He's team, and we are thankful for being a part of this particular initiative and helping us out in this season. Thank you once more.
Always a pleasure, sir, to be a part of this.
Thank you. Thank you. So, Saif, are we? Okay. Till then, we can have a small chat with all the team members. Can we have one by one all the team members Team 1, Henley's Lair. Can you come on the screen? Get your audio video on. You would love to have interact with such great stalwarts like Dr. Sharmila, Dr. Madhuri ma'am, and Anurag. This is an opportunity for you to come across them and have some small chat with them. Come on, Team 1.
All of them then.
All of them. Okay, all of you get your videos on. Come on. We can have it randomly. Yes, so Team 2, Netra. Come on. So you are from which place? Arvind Hospital.
Yes, sir.
Unmute yourself. Coimbatore. So I think Sharmila from your state. You can have a small chat with this girl. Please introduce yourself once more.
Yes, sir. Aravind Eye Hospital, Coimbatore has one big quiz master there, Dr. DC, sir.
Yes,
And
sir.
I think this time is not mentoring. Who's your mentor?
Amrita, ma'am.
Yeah, this time others are mentoring. So it's nice to have them. They're always there in every quiz.
Oh, good, good, good. Congratulations. I know that Arvind Eye Coimbatore mentored mostly by most of the times by Dr. DC. We always have in every season 2 or 3 teams and most of them make it to the finals. So congratulations, keep coming and keep playing and keep your fingers crossed for the, let us see whether you make it into the semi-finals or not. Till then, we have this 3 people who have made it into the top 3 in the private practitioner category, Seed, Win and Sai. So just raise your hand so that we can admit you as into the Zoom platform so that we can have a discussion with you as well. Sid, Win and Sai. So till then, let's move on to the next team, Team Green. Can you unshare the screen, Sai? Yes.
Anyone?
Any
So
of the
how
teams
is-
there with us? Can why don't you get your videos on, audio videos on, all the teams, please? Yeah, come on. So we have Team 16, Winnie. Just introduce yourself and you will be chatting with Anurag following that.
Sir, I am Dr. Vidyanti from Patna Medical College and Hospital, Patna, and I am GR2.
Good evening, sir. Myself, Dr. Neetu Sinha from PMCH Patna, and we are GR2.
So from your east, Anurag.
Why is it called Vini? What does Vini stand for?
It's our ship name. It's Vidya for VI and Neetu for NWE. That's why it's Vinny.
Oh, like Virushka.
Yeah. So Vinny
Would be coming down to Patna on the 29th of June. So I hope to meet you there. Anand Jyot, what's that hospital? Anand
Akhand Jyot
Akhand
Hospital.
Jyot, yeah. Akhand
Yes,
Jyot
sir.
Eye Hospital. Yeah, right.
Welcome, sir. Welcome to Patna.
Thank you so much. Keep some litti chokha ready for me. Love that
Sure,
dish.
sure.
So best of luck. Okay, so now let's move on to the other team. Which team is there with us now? Yes.
Good evening, sir.
Feki Kayals.
Good evening, sir. My name is Dr. Ishan, sir.
Yeah.
I've met you when you came to Belgaum, sir, for a CME around 1.5 years ago.
Correct,
At
correct,
that time.
correct. Madhuri ma'am from your region, you can have a small chat with these guys.
Are you Canadian or Telugu?
No, ma'am, I am a Punjabi, ma'am. Yeah, so just doing my master's over here, ma'am.
Okay, nice.
Yes, ma'am.
And your partner, team partner.
I am also from Punjab, sir.
Naam bolo, bhai, naam bolo.
She's Dr. Tanu, sir. She's my wife.
Okay.
Oh.
Oh.
Yeah. Domestic participation, huh? I was wondering what are those suitcases doing lying up top your
we are in a room only, sir.
Ideal for them if they had named them.
Good, good. So the next team is again any other team? Yeah, team Retina Stars. What is that here?
Retina Star.
Yes. So I'm Urcha. I'm Vaishnavi. We are from Kasturbha Medical College, Mangalore.
Okay. So both of you are interested in retina? Some glow in my eyes.
She is.
Huh?
She is. Vaishnavi is.
Oh, both of them are pointing fingers towards each other. Whenever it comes to retina, it is so less glamorous that most of them just shy away from it.
No, what you can do is you can help each other actually. You drop a nuclear, she retrieves, and then she drops one and you retrieve it.
Good. Best of luck. Okay.
you, sir.
So any other teams, PG teams with us? Okay. So we have a Jean, come on. Madam Madhuri ma'am, you can interact, have a small chat with these guys.
Hello,
Hi,
ma'am.
introduce
Hi,
yourself.
Hi.
I'm Dr. Vinayak. I'm Gahan. I'm Dr. Gahan. I'm originally from Hyderabad. I'm doing my MS in Guru Nanak Eye Hospital.
I'm from Bangalore. I'm also a postgraduate in Guru Nanak Eye Center, New Delhi.
Okay. How many surgical chances you get?
We get a lot, ma'am.
We have operated a lot.
Fake also.
150 fake
I
was
mean,
No,
done
no,
once.
he has done 150. I'm still at 90 or sorry, 70.
which year are you in?
Third year.
Third
ma'am.
year.
Achha, nice.
Third year.
How do you manage your complications?
The SRs and seniors are very helpful, ma'am. They pitch in
Okay.
and we get
Why
chance.
is your fan switched off?
Sir,
No,
there's
sir.
heavy rain in Delhi. Like,
So
Okay.
there's no
Yeah.
current.
Got cooler, right?
we have switched on our flashlights so that we
You
can
can see
interact
us.
with you.
Nice jugaad.
Sir is only looking what is on the background.
I do. Details. Attention to details.
A surgeon should have an eagle's eye. Correct, Anurag?
Absolutely, sir. Spot on.
Yeah. So Jinek boys, remember Madhuri.
Oh. The central host is frozen.
Best of luck.
Thank you, sir.
Thank you, sir.
Okay, team 20 eye catchers.
Sharmila ma'am.
Sharmila ma'am. Introduce yourself first, guys.
Good evening, everyone. I am
Good
Dr.
evening.
Saifuddin Alam.
I'm Dr. Aishwarya.
We are from Yanapoya Medical College, Mangalore.
We are in final year.
Now we can hear them, ma'am.
Yeah, wonderful. Actually, even many times you can hear them well. Only during rapid fire, we were not able to hear them.
Thank you for the call, ma'am.
Thank you, ma'am.
Amazing.
Chalo, best of luck, better. So now let's meet
you.
our private practitioner, Vinith. In the private practitioner category, he's amongst the, he's always an habitual guy. He always be there. कहाँ पे हो विनीत भाई?
सर मैं आरपी सेंटर में।
हाँ वहीं पे से हो। अब नहीं क्यों अंधेरे में क्यों बैठे हो भाई?
सर वही ऐसे जीनेक बॉयज ने बताया यहाँ पे हेवी रेन हुआ है तो मे बी सम लाइट इशू।
So the capital is in dark.
Yeah. Maybe sir.
Or is it the siren which has sounded and there is an alert? Blackout.
Not yet any news of that, but maybe.
So best of luck. अनुराग ये भाई आरपीसी का है बंदा, ये हरदम ही प्राइवेट प्रैक्टिशनर कैटेगरी से हमारा पूरा पैसा सूर्या सर का जितना भी पैसा है यही लेके जा रहा है.
I was wondering, yeah. But very nice, very nice. Thank you so much for participating and playing and winning. Thank you so much. Just be with us all the time. We enjoy your company, sir. Thank you.
Thank you, Vinith.
विनीत आज के क्वेश्चंस कैसे लगे?
हाँ, now you can evaluate.
हाँ भाई तुम तो एकदम इनिशियल से सर ये हर सीजन में है पहले
I've
ये
seen him. Yeah, that's true. मैंने देखा है
Yeah.
इनको.
There were quite a few questions. Those had मतलब like I had to put my mind into them. Some were like tricky ones. So and few were there whom you can guess the answers by just looking at the options. You don't need to actually memorize the entire classification, especially that least classification that was asked for BPC and all that. So they were quite. I got I think around 11 or 12 correct today.
Good.
And what about did you attend the rapid fire round? At least.
Yeah, ma'am.
Yeah.
I attended the entire quiz, but they were of very good quality. Like there has been a uniform pattern throughout all the 4 quarterfinals. I did not attend the third one, but other 2 and today they were all comparable. More or less the questions were comparable.
Good.
आपके हिसाब से क्विज मास्टर्स पास होने चाहिए.
सर मैं भी लास्ट टाइम मैं उस तरफ भी था एक आधी क्विज में.
Good. Chalo. Absolutely great. Vinith, keep playing with us. We are extremely happy that you keep on participating and participants like you keep on engaging. Means, always giving us more better targets to do that. So we have mentor Dr. Raman Rao, Suresh Raman Rao, sir. He's a mentor. See, one of the
Team
teachers
15.
who has been following Team 15's mentor. Sir, are you there with us still? You can just get your video on. So there are teachers today who follow their students even at such a late hour of 9 p.m. And this is the dedication and commitment we salute to the teachers of today even. So it all goes to Madhuri ma'am as well as, yes, sir, Suresh sir. Madam Sharmila ma'am, Dr. Suresh sir is a mentor for team number 15. You are also a teacher, again a faculty.
Suresh sir, you're muted, sir. You're on mute.
Just unmute. I'll just unmute.
Yeah.
It's good now? It's good?
Yeah, I can hear you, sir.
Yeah. Nice meeting you, Dr. Prashant.
Thank
we
you,
keep on
sir.
meeting, we keep on bumping each other in so many conferences.
True.
And I'm a mentor since about 2-3 years. And this time, my students of Shadhan Institute of Medical Sciences, Hyderabad, they come to the quarterfinals. So I'm the mentor. And as you said, it's a learning experience for them. And for me and us, it's a teaching experience. So it's good we can teach the students, and so that everyday clinicals in their 3 years posting, they can improve and they get confidence. I feel they get confidence, and as my PGs told me, they lose their tension. And this helps in their theory, helps in their clinicals, helps in their viva, and maybe also in the future practice. So nice talking to both of you. And it's good. It's about just 9:05. So I'll be just going for dinner.
No, thank you, sir.
Nice talking to both of you. And I'm good to see my students in the quarterfinals.
Thank you, Dr. Suresh, sir. If we have a teacher who are committed as you, why not they should be into the quarterfinals and semifinals and into finals?
Yeah, that's
it's a
good.
huge commitment of teachers like you, and we really salute you. Thank you once more for being a part of it. Thank you, sir. Thank you. I think, thank you, sir. So I think we had a small chat with most of the team members. Any team members who are there still with us? I think that it must be their dinner time. Everyone has rushed back, all the team members. They're young enough to really need, and after such intriguing questions and all, they must be really hungry. Good. So it's time for us to say wind up for today's quarterfinal 4. So friends,
we will be declaring the results soon as possible.
Yeah, by this weekend, we will be declaring, and the first semi-finals is on 4th of June. Wednesday, again at 7:30 p.m. Till then, keep your fingers crossed and watch the various groups where we'll be declaring the results as well. Once more, my sincere most thanks to Suryanarayan and his team of His Highness for helping us out with this. And all the quiz
Welcome, Doctor.
Dr. Sharmila ma'am, Dr. Madhuri ma'am, and of course, a busy surgeon like Anurag, who spares time for our every season for one of the quizzes.
बख्श दीजिए सर, हो गया आज के लिए हो गया.
Chalo, till then it is bye-bye from all of us, from our team.
Thank you so much for the opportunity, sir. Nice
Thank you.
meeting you, Shamila.
Thanks to all. Thanks to all.
Thanks to all, sir.
Thank you so much. Bye, Shamila. Good night.